In 2023, Governor Greg Gianforte vetoed a bill that would have established an ambulance provider assessment fee program after the legislature adjourned before they could approve proposed amendments. But the ambulance providers who supported the idea said they were hopeful that they'd be able to get it through 2 years later, and they were right.
This is a lifeline for all of us EMS agencies.
House Bill 56 sets up the framework for a 5% fee that ambulance providers will charge on their own revenues. The state will take that money and use it as matching funds to bring in more federal Medicaid dollars to support those providers. Don Wayland is the president of the Montana Ambulance Association. He says that extra funding will make a big difference for providers who are often running on tight margins.
Hopefully we'll have better wages, we'll be able to keep our employees, and we can afford to buy equipment on a regular basis. I think that's the same for all the little departments as well that do the same job that we do. Is we're stretched thin.
The Montana Department of Public Health and Human Services says about 75 ambulance providers across the state will be part of the assessment fee program. It applies to services that are private or community nonprofits, not affiliated with local governments.
Dillon, Montana, that's a private 501c3, Troy, Eureka. I was shocked when we started looking at it. There are a lot of them out there in Montana.
HB 56 becoming law is only a first step, though. The state will now have to put together rules for how the fee will be administered, and they'll need approval from the federal government before ambulance services can start getting payments.
We would love to see it enacted next year. We really can't wait.
A budget analysis done during the legislative session estimated that this bill could bring in another $30 million a year in federal funding, but that number is still subject to change if there are major changes to Medicaid on the federal level. In Helena, Jonathan Amberian, MTN News.